My name is Nee-Kofi Mould-Millman. I'm an associate professor of emergency medicine at the University of Colorado. This presentation is about our high-efficiency EMS training program. I'd like to acknowledge multiple collaborators who enabled this work to happen at the University of Colorado, at the Department of Defense, and in South Africa at the University of Cape Town and the Western Cape Government EMS system. We have no conflicts. This study was funded by the Department of Defense, the NHLBI, and the Emergency Medicine Foundation. In terms of background, low and middle income countries have a disproportionately large share of the global burden of trauma. And we know that continuing trauma education is promising, but often ineffective in its ability to change provider practice and improve patient outcomes. Consequently, we developed and tested in 2016 a novel methodology of teaching and training providers that happens on-site in a very pragmatic and efficient manner, we think, called the HEET program, a high-efficiency EMS training program. The objective of this specific study is to assess longitudinal educational effectiveness of the HEET program in a low and middle income country, specifically in South Africa. The design was a quasi-experimental trial in the Western Cape Government EMS system, which is in the Western Cape province of South Africa. We conducted our study activities, specifically our implementation activities, in August through December of 2018 and followed outcomes prospectively through January 2020. The EMS provides care to a high trauma, high mortality population. It's one of the highest rates of trauma in the world in the Western Cape province. We had an intervention site, which is one EMS base with about 100 EMS providers, and we had a matched control site. We looked at quantitative and qualitative outcomes. Quantitative outcomes were assessed via knowledge, attitudes, and skills assessments. These were standardized assessments administered by a dedicated and trained EMS assessment team immediately post, and on months 4 and 12 post-assessment. We married the work to some qualitative, some semi-structured interviews that were conducted immediately post-intervention. And the target recipients were the EMS providers. The implementation strategy of our HEET program is described as a low-dose, high-frequency, peer-led program. In other words, this is a 15-minute training program designed to be delivered to each provider about once weekly by a near peer, a trained paramedic, who's specifically trained on this program. And this occurs at shift start for the morning shift and the evening shifts at 0700 and 1900 hours in the back of ambulances in a very protected and intimate setting. And the specific content for this specific study was hemorrhagic shock, a bundle of care that we had developed and implemented. The analysis of this study, again, the quantitative results were analyzed using a difference in differences approach, where the difference at the intervention site was compared to the difference at the control site. Qualitatively, we converged our quantitative findings with our qualitative in a more exploratory fashion. In terms of results, we conducted 728 unique assessments corresponding to 269 providers. There was no difference in recruitment rates at both sites, and there was no difference in demographics, specifically age, gender, EMS rank, and experience was similar at both sites. I'd like to orient you to our results graph. So on the vertical axis, we have the mean, in this case, knowledge items. And on the horizontal axis, we have the time, pre, post, at 0, 4, and 12 months. Red is the intervention arm, blue is control arm. So immediate post-intervention at T1, we noted that the intervention arm in terms of knowledge gained was about 26% compared to the control arm. This is post compared to pre, and intervention compared to control. We know that the intervention arm gain in knowledge seemed to be fairly sustained all the way out to about 12 months, corresponding to a 20% mean improvement over the study period. The effect seemed to be fairly consistent between basic, intermediate, and advanced life support practitioners in our subgroup analysis. In terms of skills, we similarly noted an improvement in the intervention arm immediately post-implementation compared to the control arm. Similarly to knowledge, the effect was sustained at around 12 months post-intervention, corresponding to an overall 15% improvement in skills gain at the intervention arm compared to the control arm. In our subgroup analyses, we noted again that for the most part, there seemed to be consistency amongst all the subgroups of basic, intermediate, and advanced life providers, specifically an improvement immediately post-intervention, and that effect seemed to be sustained around 12 months post-implementation. However, when we look at self-efficacy, that is confidence, self-perceived confidence and ability to perform certain tasks around hemorrhagic shock care in an ambulance, we didn't pick up a significant difference between the intervention and the control arm. Overall, we noted about a 10% improvement in our intervention arm, which was mildly significant, especially around months 4 and months 12. However, when we did our subgroup analysis, we note the largest improvement tended to be amongst our advanced life support providers. It's worth mentioning, that our qualitative work picked up significantly, improved or boosted self-confidence and self-efficacy in our intervention cohort compared to our control as a result of the intervention. And further work has identified that our quantitative instrument perhaps failed to measure some of these differences. So in conclusion, our HEET intervention appears to have improved educational effectiveness. Knowledge was most improved, skills was modestly improved, and self-efficacy was least improved. And importantly, this modest effect was sustained around 12 months. We think HEET is a practical program to implement in a resource-constrained EMS system, in this case in South Africa, demonstrated by this study and by a prior pilot study in 2016. However, further research is ongoing specifically to assess clinical outcomes and the cost effectiveness of this program. Thank you for your attention.